Our debate now. Former Health Secretary Jeremy Hunt has said that the NHS suffers from a cover-up culture around avoidable deaths, which constitutes a major structural problem. The former Health Secretary claims in his new book that he encountered a widespread fear in NHS management that being honest about problems would undermine public confidence in the service. His comments come as a record 1 in 9 people are currently on NHS waiting lists. A new report from Policy Exchange also shows that NHS bureaucracy has doubled since the pandemic, while the frontline workforce has seen little change. So our question, does the NHS need major surgery, as Jeremy Hunt suggests it does? We're joined by the oncologist and professor at St George's Hospital Medical School, Angus Dalgleish, and former NHS nurse turned writer Sarah Jane Palmer, Sarah Jane, and welcome to you both. We'll start with you since I've introduced you so erroneously. The bureaucracy thing, biggest employer in Europe, 1.3 more employees. It's always going to be charged with bureaucracy, isn't it, Sarah Jane? You've seen it from the inside. You've seen how it works. Presumably you've seen how it can be improved.
Yeah, I think there's always opportunities to improve through doing things like a root and branch analysis of every sort of area. But I disagree with Jeremy Hunt in what he said about a cover-up culture and rogue system, because I think that's far too generalised and unfair. And yeah, there's always chance to observe areas that can be improved, and there's always a quality improvement initiative in every NHS trust. So usually that is the thing that helps the system work through any problems as they come up, really.
Professor Dalgleish, do you recognise that depiction of an organisation which isn't transparent, in fact actually is encouraged to be opaque about things, apart from anything else, to avoid being sued?
Yeah, well, I do, and I also recognise an organisation that doesn't listen to its clinicians and those at the working face on the ground, and is run entirely by a management that has decided what it wants and what it's going to do and does not get the feedback from the clinicians. The result of this is that the clinicians walk with their feet. I mean, they've doubled the pay bill in the last 2 years, but the number of people that have left who are just exhausted, and I know so many of my colleagues have left early, they've taken early retirement because they feel they cannot get their point across, they cannot deliver the medicine at the level they'd like to. And they are treated really as pawns in a system that doesn't value individuals, actually. Everybody's treated as just a working prole to do a job, and if they don't, or if there's a problem, they're rapidly expendable. I have seen so many good people be put on gardening leave for the most ridiculous accusations, which are often not founded, but cause unbelievable amount of trouble, and often the person decides they're not going to come back. And I have made really serious representation at the highest level and to Jeremy Hunt. And I found that I was not the only senior clinician who said the same thing. And we were treated with banality, generic letters, which mean they hadn't read the point, they didn't answer point by point. And, the system just rolls on as if everything's fine. And I can give you lots of examples if you wanted.
No, I mean, sadly, no, and we trust your judgment on this, Angus, because we're aware of what your experience is, and it will ring true for many people, the picture you paint there. Sarah Jane Palmer, just a thought on the sense of crisis within the NHS right now. I mean, it's a headline you could pluck out of recent decades: sense of crisis, waiting list crisis. Nothing changes in the eyes of many.
Well, I think there was an opportunity to change this long ago, really, when Jeremy Hunt had his 6 years as Health Secretary. I think he could have taken quite decisive action then. And when he pledged to actually get more GPs, for example, he actually lost them, and a lot of staff left in their droves as a result of his actions. So I think that these problems are on a continuum that we're always seeing, because the politicians that are actually in charge of helping the health system through any crisis aren't really fit for the job. So I think that, it's all very well for me to say, I think it's a huge system and it's a big thing to manage. But I think, as Professor Dalgleish was saying, I've seen a lot of staff leave as well. I've seen a lot of problems. I know that also PTSD is on the rise among staff in the NHS, and also suicide rates aren't, they're quite high as well. So I think there's just there are constant problems, but I'm not quite sure where I'm going with this. But I don't know.
You won't be displeased to hear me say we've run out of time. Sarah Jane Palmer, we appreciate yours, and English Douglas, thanks both very much indeed.